Mads Gilbert is the medical head at the Clinic of Emergency Medicine. That's at the University Hospital of North Norway. We've spoken before. It's a pleasure to speak to you again, Dr. Gilbert. We just heard our correspondent talking about the rubbish in the streets, the untreated sewage. At times, it sounds almost like we're talking about another world back in medieval times. I know you spent time in Gaza. What do you make of the conditions that we're hearing about?
It is medieval, certainly, and it's man-made 100% by the Israeli government and the Israeli occupation army with the support from the US. Look, the last known case of poliovirus in a human in Gaza was in 1984. That's 40 years ago. Israel has actually turned back the clock in Gaza when it comes to healthcare by 40 years through systematic sieging of water and food and medical supplies, the basic living condition and the cleanliness for 2.2 million people. They have systematically eradicated the Palestinian healthcare, which was quite well functioning before October 7th. And they have starved and weakened the whole population through this continuous ongoing strangulation of all elements in a civilized society, so that in particular the weak members of society, the children, the pregnant women, the lactating women, the sick and the elders, are even more weakened, so they are not able to resist disease. So we're 40 years back, and this has been a long-warned disaster. We have been shouting, crying, arguing about this for 10 months now. And only now, when the poliovirus is actually threatening the Israeli occupation soldiers, it comes to the attention of the Western world. So this is a massive public health disaster. And as your reporter mentioned, it has been pointed to with hepatitis A that has been prevalent in Gaza for many months. And of course, it is impossible to keep your personal hygiene and the people's hygiene when, for example, in the Deir Bala UNRWA school, there are 14,000 refugees in one UNRWA school sharing 25 toilets. Now you can imagine 25 toilets for 14,000 people, no water, no clean water to wash your hands, no soap. This is a ground for spreading all types of diseases, and it is done on purpose.
Would it be something simple or difficult for external forces, it might be Israel, it might be other members of the international community, to fix? I mean, would it be easy to fix this problem?
There is a very easy fix to this, and it has been on the table for 10 months. It is to lift the siege of Gaza, to let in clean water, open the pipelines, to let in fuel and electricity so that you can run the sewage pumps and the sewage cleaning system and operate the solid waste garbage trucks, to let in medical supplies and medical staff for the hospitals, and of course to allow food for the people. These are extremely simple, basic provisions that would prevent the spread of infectious diseases. What we're seeing now is unprecedented. A Western army supported by the NATO, by EU and the United States are completely demolishing a civilian society functioning at a very high level, actually. Gaza was never a sort of a third world kind of society. It's always been functioning at a high level. So the easy fix here, it is to stop the bombing, ceasefire lasting. It is to open the siege and allow unlimited access for water, food, hygiene elements, soap, and medical supplies for the hospitals, and to make human security top priority, both for the patients and for the common population. It's very easy. It's only a matter of will. Israel doesn't want it. They have the support from the US. And this poliovirus, it's only the tip of the iceberg. The massive part of the iceberg is this looming public health disaster, which will kill more people than the bombing itself. And it's about 4 months ago, the Minister of Health in Gaza, Dr. Youssef Abrish, he told me it is the triangle of death in Gaza now, which is really the big killer, and that is starvation, lack of water, and diseases, in particular infectious diseases.
Those are words to remember, the triangle of death. Thank you for your analysis, Dr. Mads Gilbert, my guest. He's from the University Hospital of North Norway.